We'll start with the top of the head and work our way down. In the brow area and in the forehead, like I mentioned before, the eyebrows tend to descend. Overactivity of the muscles of the corrugators and the frontalis set up wrinkles in these areas, and we've talked about treatment of those. But this downward trend of the eyebrow tends to give sort of an angry look or a tired look. And I often have patients come to me and say, I look angry or tired. I don't feel that way. People ask me why I'm angry or tired, and I just don't understand why this is happening. And often it's that the brow has come down. And this is an example of a patient like that. This person is not trying to frown. She has very active corrugator musculature. The eyebrows have descended particularly in the medial area, and this is causing a tired appearance to her, an angry appearance to this whole area, and she is not that way. And she wanted to do something about that that was a little bit more permanent than simply treating with Botox. The surgical answer to this is a Browlift procedure, and Browlift procedures have been around for many years. The traditional Browlift procedure involves an incision from one ear all the way around the top to the other. Essentially, you take the forehead and you lift it up, you remove some extra skin. Fairly straightforward concept. Variations of that include placement of the incision. Basically, do you place the incision at the hairline? Do you place it back in the hairline? And these are very specialized types of Browlifts in certain situations are not commonly used for aesthetic surgery. The problem with these techniques is, as you can tell, it's a large incision. You can expect a larger or longer recovery time associated with that. And in addition to that, because the nerves for sensation run from here all the way back over that way, you're actually cutting off those, and you end up with numbness of everything posterior to that incision line. So you have a numb scalp behind there. And you can imagine that would be quite a nuisance. An exciting development in the 1990s was the development of endoscopic techniques for surgery, and in this case, endoscopic Browlift techniques. Using this, we actually were able to make small incisions in the forehead and not have to make that large incision. Use specialized instruments and scopes to watch it on the TV screen rather than have to have it all open. Go in, release the muscles, release the eyebrows as necessary, and elevate all the tissue upwards without the problems of numbness and with reduced recovery time. So this is one of the first examples of a really minimally invasive technique in aesthetic surgery. There was some controversy initially about whether it was as effective, and studies have shown it is just as effective, and I'll show you a couple examples of very natural appearing effective Browlifts that we've performed. The operation typically lasts a half an hour or up to an hour. It's done under light anesthetic. It's an outpatient surgery, as all the surgeries I'll talk about today are. The recovery is quite brief, 7 days or so. The sutures and staples come out. You can shower the next day. Typical bruising is about 7 to 10 days, and swelling is about the same amount of time. The issues addressed in Browlift are ptosis of the eyebrow, drooping of the eyebrow, and frown lines. It does not address things associated with the lower lid. And I put this stuff up. It may seem somewhat obvious, but these are questions that people often have. So I want to go through each procedure and say what they actually address and what they don't address. Puffy, tired eyes are not addressed. Crow's feet and fine wrinkles. Again, we talked about how resurfacing procedures and Botox are the best way to treat those types of problems. Dark circles and pigmentation under the eye, and overpigmentation under the eyes, again, not treated with this. This is the patient that I showed you earlier. So we can see a very sort of harsh look in the medial area, and that was where we concentrated our efforts with this particular Browlift. And afterwards, now granted there's a slight difference in the photography here, but I think you can definitely appreciate that the medial brow is elevated, slightly lateralized, and there's a much more relaxed appearance and open appearance to the entire upper 1/3 of the face with this. Another example, this is a younger patient who also felt that she always looked tired and somewhat angry. She did not have the same issue with the glabellar area, and she wished this to simply look a little bit more opened up and lightened up. She did not have any surgery in her upper eyelids, but you see much more of the upper eyelid after the endoscopic Browlift, as that's elevated that area into a much more natural and kind of open and bright position. A very natural effect is really what we go for and what I really strive for in the surgeries that I perform, and I don't want to have this sort of over-operated on look.